So we have what, 3 guests?
Yes.
It doesn't reduce emergency department visits. They still have to get medical clearance if they're gonna get admitted somewhere. Are they gonna provide medical service?
Okay, all right, we ready?
And it looks like Dr. Jamal will be joining us
Great.
online.
Okay, let me know when you're recording and ready to rock and roll.
Thank you.
Okay, this is Board of Trustees, Platte County Health Center, regular session, 6 p.m. on May 15, 2025. Let's do a meeting opening roll call. Susan.
Present.
Cam.
Here.
Jeff Kingsley here. Mike.
Here.
And then Zach, I believe, is not online, so he is absent for the meeting at this point. Okay, let's stand and do the Pledge of Allegiance. I pledge allegiance
to the flag
Of
of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Okay, let's see, do we have guests? Nobody guest-wise in-house. How about online? Can we introduce who's all online, please? Dr. Jamal, if you want to start, yeah.
Yeah, sure. Good afternoon, everyone. My name is Dr. Naomi Jamal. I am the Chief Health Officer at Swope Health.
Very good. Okay, and then anybody else online that would like to introduce themselves? No? Okay, let's move on then. Okay, so let's go over minutes for the April 17th meeting. Is there any cause of concern or any changes? Anything? No, trips in?
I didn't see anything.
Okay,
I would make a motion to approve the minutes.
okay, so we have a motion, we have a second.
I was second that.
Okay, no other further discussion. Let's vote. Susan,
Yes.
Kim,
Yes.
me, yes, Mike.
Yes.
Okay, done deal. All right, Andrew, if you want to take over and run the show, go for it.
Okay, well, the first thing is an update from Dr. Jamal from Slope Health. I think at the last meeting, we discussed a little bit, just kind of reviewing the numbers and reviewing the customer satisfaction, which was pretty much really positive. Just, I think the thing that we saw together was that the people coming to this clinic is not quite as numerous as what we'd like. And so I think one of the things that we discussed as a group, Dr. Jamal, was inviting you and just kind of looking at things maybe the health department and the board of trustees could do to help get the word out, whatever it would take to maybe just have more volume. I think we've all been pretty impressed with certainly the customer satisfaction now that we're getting that routinely and just being able to monitor that. That's fantastic, because before that we didn't really know. But then just some of the additional services like having dental and, you know, some of that is fantastic to bring those services to our constituents. So without further ado, I'll turn it over, and I'm sure the board will have some questions as we go along.
Would invite to hear from Dr. Jamal and what, are there any suggestions from Swope? Anything that's worked in the past that you guys are wanting to suggest? And if so, we'd love to hear it. If not, I've got some ideas.
Yeah, sure. No, and again, thank you so much, Andrew, for that introduction. As you said, you know, we've kind of been at the clinic now a little over 6 months at this point. Again, as we were initially entering this partnership, we were expecting, we weren't really expecting, obviously, from the get-go to have really high numbers. You know, we were expecting a bit of a time period where there would be, you know, some time for us to build up. And so in that build up, I think we are now at that point that we've kind of gone through the initial 6 months in a new community, attempting to figure out what is needed. And we really at this point are ready to really talk through some options to try and get patients in.
You need to cough. Go ahead, do your thing. This is Dr.
Great
Kingsley. One of the things that kind of brought this up is my wife's a nurse practitioner, works at Children's Mercy, and she had just asked me just offhand, it's like, so when this started working at the health department, and I said, well, they've been there for a while now, and she goes, well, she hasn't seen any advertising or anything, and so she was wondering, is there anything maybe from the health department standpoint that we could do to help uh, do better, improve advertising, get the marketing share that needs to get out there to help bring in. I'm guessing that there's a whole lot of people out there that aren't aware that the services are here, and I think it would help Swope, but it would help us to bring more people to the building and then hopefully word of mouth spreads even more. So that's what kind of started this whole thing. And I guess, and then also we just wanted some feedback how the time has been since you guys have been here, patient
Yeah,
wise.
no, absolutely. And I apologize. I, for whatever reason, needed to drink a glass of water there. So I apologize for that. But yes, I think from our perspective, again, several things. Like I said, we were expecting that the first 6 months or so, it would take time to get familiarity and for us to just get used to a clinic, not only the new community, but also the fact that the clinic is within inside of the health department, developing processes. What that's looked like for us to date, again, we've mentioned this before, and I do want to mention it again. We found the health department staff extremely collaborative, very easy to work with. I think we've developed a pretty great partnership. There's always that worry, with best laid plans, that once you try to execute all these plans that we have on paper, is that really going to happen? And I can say that from a partnership perspective, um, I believe that from Swope's perspective, that partnership has gone really well. The health department has been extremely supportive, and I hope that we've been equally responsive to any concerns that they've had, and we've been able to develop some processes around unique things like vaccinations. It was very, very important to us at Swope that we not replicate services, right? So if something is already being offered in the health department, our goal was to offer something that isn't already being offered and then to kind of use each other's services so that the health department doesn't need to go into, let's say, STD treatment. They actually have a full blown clinic there that can help with that. And so I think that that's gone on really well. And we've kind of looked at each other's services so that we're complementing those services and not replicating services, which takes a while. And I think over the last 6 months, that's gone fairly well. Um, from patient experience perspective, we're very, very happy where we're seeing that. It's typically, and again, I know that you have already reviewed those, but typically it's out of a score of 5, our scoring system, and so we are at 4.71. So that's well above the 90th centile and above 90%. And the written feedback has been pretty spectacular as well. So we're really happy that patients have taken to the change and the new team there. I think in terms of the only thing, again, that we found that we now do need to kind of increase is the numbers and the volume. And we've kind of talked about that as well. From Swope's perspective, I think we've had some shared things that we've put out on our social media and tried to kind of do some strategic um, outreach in the community. We've reached out to a lot of the local hospital systems, including North Kansas City Hospital. We meet with them fairly regularly, at least quarterly, if not monthly. And in those meetings, we bring up this clinic very, very regularly to tell them that we have capacity there. If they're hospital discharge patients, new patients who they're looking to establish care, especially if they're uninsured or have Medicaid. And so we've kind of brought the clinic on their radar and are telling them about it consistently. But despite that, I think there's a bit of a gap. We're also reaching out to the Northland Healthcare Access to kind of see if they can assist with some of, getting patients in as well. But to your point, also really wanted to talk, to the board here as well as the health department to see if there were some avenues or patients or specific, obviously the Platte County Health Department has been in community far longer than Swope has, especially at that site. So if there's um, community outreach and perhaps a patient pocket or population that we are not getting to through the avenues we've already used, then we would love to kind of partner in that as well. And then, of course, to your point, we've tried to use our socials, and because a lot of it is now on social media outside of old school print as well. And so we've heavily tried to use that. But certainly, in the Northland itself, if the health department or board members or others have reach uh, in specific communities. We would love to partner on that as well. And our communications department would love to kind of partner with you to try and see if we can get that message out some more.
When you say partner, are there any
Mhm.
specific? Yeah, I
Pardon?
mean, we're partners whether we like it or not. Because we're in this
Oh, yeah, no,
together.
absolutely. No, I meant as in co-branding and, because typically it could just be Swope alone sending it out, right? Versus the Platte County Health Department on, saying that Swope Health has a clinic inside the department. So I kind of meant it from that perspective. Because again, I think the folks that would come just for Swope Health, we have a lot of that recognition, especially at our Riverside clinic. But since we are inside of the health department, maybe, and that's what we really meant by partnering, to try and see that if that outreach kind of is coming from the health department saying we have Swope Health here, and seeing if that would perhaps attract a different type of patient population, or maybe more community members respond to that.
I'm gonna make a couple statements and then throw out
Yeah,
some ideas and questions. And
sure.
I'm gonna tag my soliloquy here with, I think this is gonna take more than just a brief board meeting here. And
Absolutely.
there may be an idea for participation in maybe some ad hoc committees, or I can come down and brainstorm with you guys, not representing the board, but just as a board of trustee member trying to help. I can do that, but I can't speak for the board.
Mhm.
What kind of volumes are you looking at to make sure this is fiscally sound moving forward? I mean,
Yeah.
that's because we got to know what we're targeting. Are we trying to get to 15 a day, 17 a day, or I mean, we got to see what the break even is, and then we can target the population. So my other statement would be, we've only got 8% of the citizens of Platte County, and since we're down here, who are underinsured. At least that's what some of the current data is. Is that consistent with what you guys know? But we're one of the most well-insured populations. So targeting the underinsured, hopefully we already have them under our belts. The other item is, I know we had some patients, and this is all really moot. We had some patients that did in the transition go down to Riverside, which is fine. So I want to focus on do we need better signage? Do we need to market Swope Health? Do we need to go ahead and put some YouTube ads out and geofence those to Platte County? Do we need to go ahead and target some of the social workers in more rural parts of the area working on transportation to get them here? Or do you market and target the well-insured population to say, the best healthcare, if it's, this is the best, and, open it up and market it that way. And I don't know if that includes signage out front here with Swope Health Clinic, but those would be some ideas. But I think we need to sit down and specifically see what what their fiscal targets are. How do we keep this viable? Because that's going to benefit the citizens. And so I would be enthusiastic to brainstorm with you all as we do things like that.
And it's you help us, we help you, right? So the more advertising that you provide to bring people in the door, the better it is for the health department to get us out there. Because I'm sure there's still a lot of people that don't know the buildings here and that we're here ready for them. So I think we're helping each other here, trying to do better marketing and better outreach to the community.
Yeah,
And
no, absolutely.
Dr. Jamal, I know we meet monthly, so maybe, the next month's June's meeting, we can have that as kind of a strategy building session. I mean, that's kind of what we're doing, but maybe we'll invite the board members. Just need to know RSVPs in advance. So if there's going to be more than 2 of you, we'll have to make it an open meeting. But
right, yeah. Kim, Susan, you guys questions, thoughts, concerns, ideas?
I like the small group idea to work with them to kind of build our marketing ideas.
First thing I would do is suggest that you get your Google Maps pin drop. It took me, when people are looking for a clinic and they punch in Swope, it doesn't drop a pin. I just opened a clinic 10 days ago. I opened a clinic on North Oak for urgent care, and the first thing I did was get that pin to drop. And people are giving feedback and it's starting to get some traction. So
Mhm.
obviously you need to be able to
Yeah.
show people where you are.
Right. And didn't we
Yeah,
have
no,
the same
absolutely. Yeah.
for us, for the health department? Was it Apple or who was it that didn't have this
You
on the
had
map?
that problem. My
Yeah.
phone worked fine.
I was just curious and say, oh, let's just find it. And I couldn't find it on my phone. So even here, so I think we just have to be very diligent to make sure that we're out there in all the different social media forms, all the maps, all that stuff. It has, both Swope and us have to be out there and
We
available.
did have that problem. I'm not sure why we had it, but it
Right.
was showing up on mine and not on yours.
Right, right,
And now it is on both.
right. So,
And yeah, I think your ideas for the emergency department are excellent because as a new board certified emergency physician back in '94, when I was working at St. Luke's, Swope Health was right up there on our referral list. There are lots of things you can do. I mean, this isn't marketing Swope. This is marketing a healthcare clinic. So we got to target who do we want to give VIP service, and the best marketers, quite frankly, are going to be these wonderful people who love the service going out and telling 5 people. I think you can try also to leverage that with asking them to give you comments, or if you can take their comments and de-identify them if they want or not, and also put them on your website. Maybe get some testimonials. I mean, I could go on and on and on, but I think we need to see what your target is. We'd be happy to do whatever we can within our power to help that.
No,
And
we
like,
appreciate that. And the target for all of our sites is 16 to 18 patients a day. And so per provider, so right now it is a single provider clinic. And so for all the days that they're there, and so again, we started off with just the 2, looking at the initial volumes and the assessment that we did, but the idea really is that we do want the clinic to grow, right? So when in those 2 days, they consistently start seeing 16 to 18, then the goal would be to start adding days, because that would show us that, okay, we've met that need, and maybe now we can start adding additional days to meet even more needs. So if a number is what we're looking for, then that's essentially between 16 to 18. That's the average range that we like our providers to be there on per day. As far as the marketing strategies, especially the ones related to Google and the testimonials, we've definitely been thinking about that, not only for the Platte County, but even for our other sites. And that is a larger strategy that we're actively working on right now with our vendor that actually helps get our patient feedback. We're actually working with them to try and see how do we automate some of that. And so we're kind of so some of those, yes, it's great that we're kind of aligned in even how we're thinking, but certainly do appreciate the idea of having a smaller work group so we can, hash out some of these ideas in greater detail. I think that would be highly appreciated as well. And we'll make sure that in that specific meeting, Andrew, we have our communications team there as well. We typically do have at least one representative from that team, but potentially having more than one as well. So that we can really kind of think through what the next steps would look like. And in that meeting, we can even kind of share further details about, as an FQHC, what payer mix we're striving for in particular. And so it's not just uninsured, it is Medicaid and Medicare as well. And so I know that traditionally we think about uninsured and Medicaid, and we don't quite consider Medicare, but Medicare is also considered a fairly um, important patient population for us in the FQHC space as well.
You guys are prepared to take Blue Cross Blue Shield, right?
I would have to connect with finance to ensure that. But yes, as far as I know, that we do have contracts with a number of commercial insurers as well. But we can kind of talk about the details of that in that smaller meeting. I don't want to overpromise without the finance team here. I don't want to promise to things
Throwing
that,
out ideas.
yeah,
Not rebrand and let your customers
yeah,
say, this is, it's not just for government
yeah,
insurance. You can rebrand and say Swope
yeah.
comes to Platte County. It's
Mhm,
got, and
mhm.
rolling out the VIP customer service, all these services in one location. Does your doctor's office allow you to have
Yeah.
seamless appointments with the dentist to
Mhm.
arrange for care? Don't get me started. That's why I think maybe at a
Yeah, no,
sub
yeah,
level, I can tell you what works and what doesn't. I've done this.
has Swope
sure.
done billboards off roadside billboards, that kind of marketing before, or is that?
Have.
Is it very
We have.
expensive beyond?
Yeah, we have before, but again, I think something we would need to think through for this year in particular. I think everyone has been following the changes at the HRSA level as well. And so we need to kind of take a lot of that into account as we kind of try and plan budgets in particular for this year.
And then if we do marketing, we could do joint marketing as well, because like I said, we need to get our name out there as well, and that the building's here. The more feet that we can get into this building, the better. I want to have a problem that we
absolutely.
build more parking. I was telling that to Andrew the other day. I would love to get to the point where we need to put more parking spots because we're at capacity. That would be my ultimate goal.
Yeah, no, and again, we definitely have the same goals there. We definitely want more people to be seen at the clinic.
And I think on the advertising, just from what you were saying, I bet a lot of people that have Medicare don't know that, or the interest. So that would be a point of interest if we were going to do a billboard or something that's different, that people don't associate quote with just Medicaid patients.
Yeah.
Do something that's a total different thing that they're like, oh, wow, I didn't realize they
Can't
did
get an
that.
appointment? We have same day appointments, could be available. If you guys wanted to target one extra day to advertise same day appointments and market not just to the Medicare, Medicaid, market to everyone.
Everybody,
That's a little outside the box thinking,
Yes.
but that's what it takes.
Yeah, we can, I think in that one-on-one meeting, we'll talk about that, how the payer mix pans out in an FQHC setting. I think once we
Told you I had a lot of
do
ideas.
that, we'll understand where we're coming from. Yeah.
Especially right now, if you've had to get into your primary care recently, at the drop of a hat, that doesn't happen anymore. And well, I shouldn't speak for everyone, but I've just noticed that is a very difficult task to.
And I will say that currently at the clinic, we do have an open access model. So we do have scheduled appointments, but almost 50% of the schedule is still left open access, which means that if essentially we don't turn anyone away is what we're getting at. So there's a lot of capacity right now for that walk-in model as well to be accommodated at the site. It isn't like, I think unlike other clinical settings, we kind of train our providers and care teams not to get too hung up on the type of visit. There are instances where folks come in and then say, well, a walk-in can only be an acute visit. That isn't what we do at Swope Health. You could literally just walk in for a well-woman exam and establish care with 3 chronic diseases. It's called an open access model, and we have that across the system. We don't restrict the type of walk-in.
That's good.
Don't tell people that they have 3 problems, they have to pick one.
Yeah.
Yeah. Well, whatever we can do to help, I think
Sure.
I think we're all in agreement that if a strategy is formulated, we will enthusiastically support it.
And we appreciate that. Thank you.
Absolutely.
And Dr. Jamal, Dustin's going to be reaching out to Brandy just to see about when she would want to schedule a strategy meeting like that. So they'll work out the details.
Sure, yeah, no, absolutely. And I think I like your idea, Andrew, of kind of repurposing one of our existing monthly meetings to focus on this entirely.
Okay. Well, Dr. Jamal, we appreciate you being online and answering questions and being available. So.
Yeah, no, thank you so much. We appreciate the continued support.
Thank you. All right, you can stick around if you want, or if you gotta go.
I, believe it or not, have a couple of other meetings after this. My day is not quite ended, so yeah. All right, then. Thank you so much. Thank you so much, everyone. Thank you. Bye-bye.
Okay, so next, computer.
So last month I made a faux pas with communication with Cindy. I thought we had that on the agenda and posted 24 hours before the meeting for the computer server and backup system replacement. I'm not already asking for a whole new one. What happened was I didn't ask for it in time. And I want to make sure that we are very honest and transparent. So this has been on the agenda the entire time as we are supposed to have it, because it obviously is a fairly big expense.
Right.
So nothing's changed from the memo at all or from our discussion last month. I'm just requesting that we approve this expense again.
Okay, do you have the little blurb at the bottom?
Yeah, I move to authorize the director to purchase a new server and backup system for the health department at the cost of $22,525.15.
I second.
Any further discussion? Susan?
Yes.
Kim?
Yes.
Me, yes. Mike?
Michael, yeah.
Great. Thank you for bailing me out.
No worries.
You can't, the way the software works, compatibilities, the backup, and then they stop providing IT support at a certain point.
Right.
It's cost of doing business.
The bylaws we discussed previously, and what you had in your packet, the blue was Jim Snyder's edits, who's our attorney, and then the red is basically what I took back and edited from what the comments were at the meeting. I discussed them with Dr. Kingsley. He seemed to think that I captured the essence. And what Jen put in, if you look at it, is just some mainly legal protection and some specificity for
It's
some
real clear.
things.
Yes.
You did a good job.
But those, I believe, should be all straightforward, but if you have any questions, I'd be happy to answer them.
Look fine to me.
I read it, I thought it was fine.
And Kim, I think you probably saw, hopefully that was what you meant with, like, I may have said it a little different, but we'll meet for sure every other
Every
year.
other year.
And then the
So next
other
year will
years,
be
we'll
the
just
year.
kind of bring it up as consideration is what the. board
Unofficial
discussed.
review.
Yes.
Right.
That sounds great.
And then obviously if there's a specific issue that comes up, it's on the bylaws that we can do a meeting, but we could do that anyway, regardless of what that is.
Right.
So, Mr. Chairman, do we need a motion to accept the bylaws?
Well, before we do though, does everybody have a chance to look at it? Because this is what we're gonna go for like 2 years. So,
Yes.
Yeah,
Yes.
so everybody's cool. Go ahead.
I'd make a motion to accept the bylaws as presented.
Okay, do we have a second?
I second that.
Okay, any further discussion? Okay, Susan,
Yes.
Kim,
Yes.
me, yes, Mike.
Michael, yes.
Very good. I think, do you have the copy of the sign?
Come prepared, we read through all
Yeah,
those,
yeah.
ready to roll.
He and I went over, we were nitpicking as I was going over with him.
Kim, you might have
It may be in here.
okay, you might have the real copy that gets signed.
Oh, yes.
Okay, so if you want to go down to my report. You can keep going down. So one of the big news items, and I think most of you know, we have had continuing humidity problems for years now. And they have now installed the dehumidifying equipment. We had training on it on May 5th. I'm actually going to need to be retrained because Dan told me I'm not trained well enough, which is actually pretty obvious. I'm not quite trained enough. We're having some trouble getting them connected to the web and then adjusting the humidity, but the humidity has been around between 50 and 60% on the most humid days and below 50 on the others. So it is working. We are going to probably need to adjust it to 45. It's set at 50 right now. And depending on whether you look at EPA or CDC, it's either 30 to 50 is ideal or 40 to 60. It just kind of depends. A lot of times in healthcare settings, they want it 40 to 60. Yeah, but we're going to try to keep it in that between 40 to 50 and kind of capture both.
So it's been humid the last couple of days. So how was it?
Yesterday,
Yeah.
there were parts of the building that were fairly humid, but we've also changed these new thermostats allow us to actually run the fan all the time like it's supposed to when the building's occupied. And when it's doing that, it's picking up some, because it's running through the RTU, it's picking up some of that hot, humid air outside. When it's that humid, like yesterday was, and it's kind of a jolt, we're not used to it, people noticed that it was humid. Today, I think one area, but in the morning, a couple people said when they first came in, so we're going to adjust what it thinks operating time is, so it's nice and ready for them. So we'll move that.
How was the nurse's station at the back area? That's probably the hottest part of the whole.
It was 74 degrees. The thermostat was, or it was 75. The thermostat was set at 74, and the humidity was rock star back there. It was like 40% or something.
Yeah.
So it was quite pleasant. Those that area, I think, with the blinds, I mean, honestly, the sun just not hitting everything and heating stuff, magnifying has helped a tremendous amount. But we're still, so everything's been installed. That doesn't mean like all the work is done. We are still trying to normalize things.
How about the lobby when people are coming in and out? How about the humidity there?
I noticed it was high today. And the temperature was high. But the door kept getting propped open. Not propped up, like people were opening it and holding it open. So we have some things just to monitor and make sure everything's working correctly.
We're gonna have to tune the system to deal with that. And the system he has in here can be dialed to handle it if we were in a rainforest. So it's just a matter of tuning the system and making your adjustments, winter, summer, but I mean, it's an extremely robust $40,000 dehumidifier.
Yeah, I think that's where we're at, is just making sure everything's, like Dan was probably frustrated that he didn't have the ability, like, Andrew, why haven't you got these hooked up? Because I used to be able to just change the temperature and it worked well. And we'll get back there, but it just takes a minute.
So it's not recognizing the Wi-Fi, or what's the deal?
It only works on 2.4 gig, and it is recognizing everything except registering the name. So somehow between the equipment I'm using to talk to the thermostat, I just am going to need some more time to work on it. And
Okay.
Dan said he wanted it yesterday.
But even when it was horrible, it wasn't horrible.
Right.
Yeah, yesterday, because it looked pretty humid yesterday.
I think it's, one of the first times we had it that humid and warm.
Okay. All right.
You can scroll down. As far as the budget, revenue, we're at 72%. We're of course a third through the year. For expenditures, we're right at the same amount of the year almost. So we're going along just about exactly where we should be. We're at 30.3%. Our money market balance, I actually had to look at this because we were about $21,000 more than we were last year. But if you look at 24 to 23, it was 106 more. And I was thinking, what's going on? Well, we are allocating more of our money to certain things, like putting it in a reserve fund, putting it into paying off the building. So we are more than we were last year, but not markedly more because we're utilizing the money. So then I'm like, oh, that's why, like, that makes sense.
We're filling our emergency piggy banks.
Right. So we're doing exactly what we're supposed to be doing, because no one's going to appreciate any government entity just building up piles and piles of cash. If you don't need it, then you shouldn't be collecting it. And so this is actually the model we should be following. It just took me aback looking at trends. If you look at our lease purchase debt obligation, from last year to this year, we've paid about $250,000. So we're trucking along,
That's pretty good.
and that's my report. I think you all know Dan is retiring
What?
next month, right?
Next month. That happened fast.
That happened
Yeah,
way
have you
too
figured out when you
fast.
want to do your party and all that kind of fun stuff? 'Cause you need to tell me ahead, otherwise I'm gonna be
I
not.
think-
making it.
Hawaii,
I
is that where
think,
you went to party?
I think the announcement will be coming out, right? If you
Yeah,
pick the date.
the 26th of June is, I assume, a small reception. I assume in the afternoon. I don't know if the time has been set.
I've got from noon to 6 in my calendar.
Oh, it's a big party.
Wow.
Yeah,
I blocked,
You'll be
I
worn
blocked it,
out
so I
after 6 hours.
I would think 2 hours max, but, so I was thinking probably 2 to 4, but I'll wait and see. What the-
How about the week
COVID
before, though?
I'm sorry.
The week before, maybe? Because I work that day,
Oh, do you?
unless you don't want me there.
No, I do.
He's doubling down on that.
Oh, yeah, you're not gonna be there.
He's
That's
locked
perfect.
it in now.
Yeah, that's perfect. We're gonna do that then. You do what you gotta do, but yeah, I'll have to work on the 26th, so just.
And I'm
warning you.
gonna probably be out of town on the 26th.
Well, we'll set up a
This
camera
isn't
so
about
you
us,
can
though, it's
zoom
about
in.
you.
Yes, yes,
If the 26th is what you want, then you do what you gotta do.
yes, yes,
Yeah, and I hopefully we'll see you at the board meeting.
Yeah.
Next month's. board
Yes.
meeting.
Yes.
So, which is funny because he was telling me before this meeting, he's like, I'm gonna try to see how I can get out of that meeting.
I don't know if it's in the agenda or not, but I'll take us on a tangent just for a second. I presume that there's been processes occurring to work on replacement, et cetera.
Yeah, do you want to speak to that?
Sure.
I mean, I'm not obtuse. I kind of have a sense, but I'm not sure.
I
everybody
guess
else
the question is, because open forum, we can talk about this, or is this a
Yeah.
personnel thing? Okay, go for it. Do your
I
thing.
mean, because there's not been interviews or
Okay.
anything yet. Typically, when we have people within the health department that qualify for a promotional opportunity, we open those up within house first,
Mhm.
typically 3 days. I think that went out this morning.
Yeah.
This morning. And so in 3 days, we'll either have someone that we will go ahead and interview before we open it up to the outside. If we can't find anyone internally that is qualified or that wants the position, then we will move outside. I believe we have had one applicant, so we will at least do one interview.
Okay, there should be a whole lot more than just one, I'm just saying.
Some of it is going to be the qualifications because it's, MPH is preferred with a minimum of 10 years of public health experience with 5 years of that in public health leadership. Or if you don't have an MPH, it is 12 years of experience with 7 years of public health leadership experience. So it is some lengthy experience qualifications and education.
Okay.
But it is essentially the person that would be taking over for me.
Right.
If Dustin runs me over or whatever. And I know like Dan, he's been here 33 years, he worked for 34,
Close, yeah.
34 and then 2 other years. So that level of experience and of leadership is something, we're not going to likely be able to replace.
Right.
But we do want someone that is up for the challenge of that position.
My expectation for the executive team is that people that are qualified should be applying, even if you're not interested in the job, just the experience of applying and going through that, because you're gonna need that experience for something later. Eventually, my hope is all of you become directors someplace. Right, so, yeah. So even if you don't get the position, you went through the experience, and that's gold. So,
Next.
Well, along those lines, we've had, and I think maybe Dustin and Taylor will talk about this later, but they attended a leadership challenge this past week, as well as Bailey Moore and Tricia Rothweiler, our environmental health and community health education supervisors attended that leadership challenge. So we do have folks that are working on developing their leadership skills. But we also have an employee who's applied for the 2025 cohort of NACCHO's RISE program, which is a program for emerging leaders in public health. Usually they pick a cohort of about 10 people nationwide who have less than 3 years of experience in public health. So I applaud that individual, and hopefully she will be successful in getting one of those fellowships. Other than that, other than what's in my written report there, we had Saturday before Mother's Day, the Mother's Day 5K fundraiser for the back to school fair. We had 361 participants, which is great. I think the first year, which is only like 4 years ago, we had, I think, 75. So that continues to grow each year. It's a 5K. That is a significant fundraiser for the back to school fair, or Equal Start is the name of the organization that the 501c3 that hosts the back to school fair here at the health department. Work has begun on the financial audit, the 2024 financial audit. So in the next board meeting or two, you'll be hearing from Kenny Hales, our auditor. Cindy's team, the HR and finance team has been very busy with the audit, but also the banking services contract, open enrollment, and velocity. Yeah, that's
Cindy's like, you're forgetting the most important one because everyone wanted to get paid tomorrow.
Yeah, that's our first paycheck through Paylocity tomorrow. So don't anticipate any major problems, but we'll see.
When did the checks officially roll out? At like in the morning, or when we talking? Hopefully it's later in the afternoon so that there's any problems, you get the weekend.
It's been reviewed
She's confident.
and reviewed
Okay,
and reviewed.
best laid plans, just saying.
It is, and it's a little more complex than anyone thought.
Uh-huh.
But I believe when it's done, it's all going to be good. But Dan and I were talking, and Dan's like, a little more complicated than what, even like some of the stuff. But I think part of that's the nature of having more functionality and just a lot more options. So it's a little more overwhelming than when you have like one button you push compared to like 50 buttons you can push, but you don't know which buttons yet. And there's lots of training and different things. So another thing that we have to just.
Are these paper checks or everything's automatic deposit? Okay. Wait till about like 4:45. So if there's any problems, it's the weekend and you're free.
Well,
clear
it's
till
already
Monday.
processed, so it's.
Oh,
yeah,
okay. All right. I'm just trying to help, make your life easier.
So we're good.
I don't think you're trying to.
Oh, yeah.
I don't know.
Just imagine what that
If
Monday.
you really
would
want
be
to
like.
help, you ought to show up and help them on hand. Throw pot shots at them.
Yeah, that's odd.
One other thing I would like to share is you probably noticed the changes in our televisions here, but the Safe Sitter is one of the great courses we offer, but we also had Arrive Live events at North Platte and Platte County high schools last month. And those programs are, I think you can see in your report on page 29, I believe. Platte County, we have 1,335 students go through. North Platte had 101, but that's over 1,400 kids that received a lot of messaging about driver safety, and they do some drug prevention activities as well. But I'm convinced that program, those Arrive Alive programs, save lives absolutely every year. And the kids absorb these messages, they take them home to their parents. Seatbelt usage, we've done surveys before and after, and it dramatically increases after these events. They learn about, although the messaging should be, they should have absorbed it by now, but if not, there's always more messaging about not texting and driving, things like that. But I'm convinced that is one of our more effective programs in saving lives. So just wanted to share that.
So we do first aid CPR. Is that BLS or what do we actually teach?
It is. I'm not an expert on any of that, but
What age?
Red
What age
Cross.
group is that?
I know, but I'm not sure exactly, if there's a minimum and a maximum. I mean, you mean as far as who could take it?
Yeah, we can do.
Because they go to the schools and teach it, and then they also offer it here to, childcare center childcare providers, and just to the general public, so.
Or were you talking about safe setting?
Safe set.
Oh, I'm sorry.
Yeah.
I'm sorry. I don't know the answer to that.
Okay.
Sorry.
I
Just
believe
curious.
it's around 12 to 16 or
Yeah.
something.
When I see
We can
the
get you an
audience,
answer.
when I see the audience, it looks like about that 12-year-old to maybe early teen
Okay.
age group, but
What's
very
the
well
size,
attended.
size of class you thinking?
I want to say they usually have about 15 or so.
Yeah, I was gonna say 20 and it's always full.
Yeah.
Whatever our cutoff is, it's a really popular class.
It is, it's always full, yeah.
One thing, Dan mentioned the Mother's Day 5K, just mention Slope again, because that's a fundraiser for the back to school fair, but Slope confirmed they would be participating in doing physicals and stuff. Now they have to follow their model of payment and that type of thing, but it'll be available. So they'll be able to get those stuff here, right? Hopefully that's what I read.
Yeah, and they may have a sliding fee scale, but so it won't be all free necessarily, but it's definitely a great service that they can provide.
And they wanted to participate with us,
Yeah,
so
yeah.
that'll be good.
And I think
Another great marketing opportunity.
yeah, and I believe they're going to participate through their dental program as well. So it's good. That's all I
So,
have.
so the Malbo, that's one of your little bullet points there.
Yeah.
What was the response back? Because we said we'd talk about a week or so later. What did they say?
I think, Andrew, did you talk to Missouri Institute of Public Health or Missouri Public Health Institute about that? No, I thought there was going to be some discussion, more discussion about that with Missouri Public Health Institute. I don't know exactly sure where that stands.
I thought DHSS was going to do some talking.
Yeah, they're
and
gonna have
get
their
back
own
with
meetings
us.
to get back to us in a week.
And
Is
I
what they
have
said.
not heard anything.
Okay.
I'll follow up with them.
I just don't want it to just kind of just lollygag and then fall through the cracks.
Well, it's just gonna be something that somebody's gonna have to pick up and champion. For example, make a charter, work with the public health institutes to figure out scope for function, and then a budget and cost center, and then setting it up as a 501, whether it's a C3 or C5. I forget that C3 is not for profit, but then I think there's some subsections. Those are the logistics that have to get ironed out. At the end of the day, what's the scope of work that's going to occur? You're going to, I can do a budget in 3 hours on a spreadsheet, but because you're going to have website, you're going to have phone. Initially, you may not be able to afford a full-time person, so you probably have to get a part-time one, and just for communications. And
Do you want to tell them what they all said?
Okay, so there was a meeting with the representatives from the DHSS, and if I can summarize, they are supportive of a Malbo being formed. They like that we're being proactive to do this. I didn't get the sense that there's any massive amounts of budgetary seed funding that they had immediately available. But that wasn't, I think we're wanting just to coordinate with them to make sure they're aware of it. And I think we're still in the information gathering phases to see how best to deploy this and if there is a need. I tried to spin it, I shouldn't use that term. I tried to present it as an opportunity for DHSS to leverage communication to boards of directors and to improve the dynamic between boards and the effectuators of those policies. And as the state rolls out its agenda and its goals, that one of the ways they could implement these is to go through the health departments and work with the health departments to try to deploy some of their policies and procedures.
Yeah.
That's my synopsis.
And then maybe do joint like meeting we went to in Columbia do like a part where Malvo's there too. We could do breakout sessions or whatever. Just get people involved, get excited about it, whatever. They seem pretty excited, but like you said, I think it's gonna be a money issue. So so what's the actual thing that the institute that you talked about? That's Missouri what?
Missouri Public Health
Oh,
Institute,
Institute, yeah. And they
or
might have seeding money, maybe.
possibly.
Yeah.
I mean, that's the group that I would like to lead the charge just because they have a lot of resources.
Right.
And DHSS works with them a lot. And so if DHSS is on board with it, I think that's a pretty decent strategy. And
Yeah, the conference you mentioned, that it's officially called the Joint Public Health Conference.
Right.
The organizations that hosted that historically were NPHA, Mo Alpha, the Missouri Association of Local Public Health Agencies, which is now a section of NPHA, and Malvo. So Malvo was active in planning that Joint Public Health Conference. That just kind of fell off, interest died. But it's great that you're bringing it back, and I think it makes sense to be either in the Public Health Institute or in NPHA as a section.
Right.
Well, we talked about it a little bit at the meeting, and I'll just defer because I'm kind of backing out of the whole thing. So I'm the immediate past president of the NPHA, so I have some interest there in it being a section. But I'm kind of backing out of all of that, so all of that involvement, and certainly understand the momentum that the Missouri Public Health Institute has. They're very, and plus they have paid staff. So the MPHA has paid staff, but it's contracted paid staff.
So I told them that Mike's gonna be the point man for all this. I'm just like the wingman. Do you guys, if we get this going, do you guys want to be involved too, or what's your guys' take on it?
I guess,
Because there's gonna have to be an energetic group of people to get this rolling, and then eventually, hopefully, get other board members from across the state involved.
mhm.
And then hopefully it just kind of takes off on its own, but we're still gonna need at least a basement to start from.
I think we'll know more once we have a sense for it is gonna be a completely independent entity.
Mhm.
That's probably not in the best interest of collaboration. These folks have been doing it for so many years, and I don't care if you're retired, I'm still gonna ring you up. You go to the well, as long as the well's still open. I mean, wealth of knowledge, experience, seasoning. You won't be stressed now. You get to say whatever you want. No idea, it's really stupid.
You get to choose where you answer the phone too.
So, I think what is gonna need to happen is gonna be, Andrew's gonna have to still be beating his drum a little bit on this, and if we can get something engaged, it is a forte of mine to be able to say, okay, I'll work with whatever lettered agency that wants to host a Malvo. For me, I would want to make sure its scope, its purpose, it's well chartered, laid out, and has clear functionality to enhance the communication between boards and the executive teams in each county, to also perhaps brainstorm and provide guidance, leadership, and regional meetings to get some economies of scale for services amongst several counties, because you've got 4 counties, you don't need to have an individual with the same job description in each of those. So it's going to be trying to facilitate efficiency, delivery of services, identifying, helping, what do board of directors need to best do for education to support them. A lot of that can be on a website, because if a board of director in Hickory County, rural, trying to say, how can I best support this? Well, take a look at it. We also had some brief discussions about is it Tiffany? Was it Bear? Tiffany Bear. Her education, well, I stepped in it though.
Probably got in trouble.
She did a great job coming up here, educating us.
Mhm.
And I think that there's going to need to be the encouragement of a group like Malvo to say, so your new board of director, click this for our board of director, orientation. And we can take from these different agencies and condense it down and put something there to where they can learn. We can also have, the importance is to try to coordinate the delivery of health care services with the funding and the guidance of DHSS for where their goals are. And that's the way I started out the conversation with them. I said, what is DHS trying to do? Doesn't it make sense to leverage your health departments to do it? And I think Malbo could be something that has a direct line of communication, get the support of directors, and trustees. So
Yeah,
So what do other states do? I mean, could this be patterned after?
are you guys going to the national? Who's going to Savannah?
I haven't signed up.
Are you going?
I'd be interested in going, but I don't, it depends on time and when.
I thought it was informative.
If you think it's helpful.
I think it was helpful to find out that it's supposed to be centralized, but it's not centralized.
Okay,
Every state does its own thing.
Nalbo got managed into bankruptcy.
Okay.
It's currently being managed that way. And they have outside auditors who are controlling how they're funding and things. So they're coming out of a time of struggling management, financial issues for a number of different reasons that I didn't get the vibe there was hanky-panky, but it looked like an organization looking for leadership. It's okay. They're going to stay the course and continue to evolve. Because when I asked them, I said, do you guys have a template for state board, like a state chapters?
Mm-hmm.
It's really not high on their priority list right now because they got bigger fish to fry. Yeah. Now, I did, and I have copious notes from when we were in Nashville. Utah did their own thing. It was Utah, wasn't it?
Utah.
Yeah. Salt Lake City, they have several large health districts that they brought together to coordinate that way. I think what you're going to have to do in each state is look at what does our state need?
Mm-hmm.
To what degree do trustees on health departments need to be informed, have a resource to go to, and somebody they might brainstorm and say, hey, we don't know what to do with this. So
the other thing that we'd love to be role models for, because Susan and I heard horror stories at the Columbia meeting.
Mm-hmm.
And so I think there's board members that probably aren't so great with the directors and the staff. And it could be we're only hearing one side of the story, right? But I think we could be like role models for other board members.
not only that, I did ask DHSS what their outcome targets are from a metric-based perspective. So that if we go to a rural area where there is an unhealthy dynamic of the trustees with the people trying to deploy services.
Or the person. Or
Yes.
Yes. Person.
That if we know what the health outcome metrics are for a health department, what the rest of the state is, what the nation is, it's almost, you're not shaming them, but you're pointing out how they could improve and how they know they're improving.
Mm-hmm.
And that can be communicated to them and encouraged. And if like there's one board, if there's a dysfunctional board somewhere and one of the individuals, a new individual perhaps comes in and says, can you help us out down here? And then the first thing I would say is if I was communicating with them, where are you at on your health outcomes? Where do you want to be and why? And what are you willing to do to get there?
Mm-hmm.
And then we can brainstorm and help them with, okay, here's what you need to start doing. Some of this is going to be funding. And it's obvious that and I admitted it to the folks on this meeting. Why do we have consistently, why are we in the top 2 over the last 10 years? We have Ridge County.
Mm-hmm.
Very low underinsured.
Mm-hmm.
We've got lots of resources, which brings talent, et cetera.
Sure.
Okay, let's keep rolling. Sorry.
Yeah. Sidetracked.
Yeah, everything else.
I didn't finish, thank you.
And I sent them an email. You guys got copied. Just, I told them we met tonight and that you all inquired.
Where things are at.
Dustin?
Yeah, so I did add additional, an updated version of my report, just 'cause it has SWOP's, rankings for like their patient satisfaction surveys on there. So yeah, that's to look at.
And you're doing that every month.
Doing that every month is the goal to try to get all those. So, with the being a short turnaround for the board meeting, then it's a little bit trickier for them to kind of get that. They are reaching out and still trying to get Riverside's, evaluations as well. So that way, hopefully in the future, we'll have that to kind of compare it to.
But I think it's nice that she said we want 15 to 18 patients a day, right?
Yeah.
So now that we know what,
Fine.
yeah, per provider, but we only have one provider at this point, or how many? Yeah.
One provider.
So once they start expanding their services, we'll know. But it's nice to know that that's what we should be shooting for. And then so when you see the numbers, we know what we're looking for.
So, yeah.
So a few things I did this month was, one of the more interesting things was that there's a few new people within the SCI circuit and like different health departments throughout the metro. So we had like a little summit where we all got together, started talking about different ideas, and like our goal now is to try to meet at least on a quarterly basis to kind of help strategize and how to help lower SCIs within the whole metro area, how to better connect all of our patients to care, and just really meet patients where they're at. Kansas City especially has a large homeless population, and not all of them are really prone to going to the clinics to get treated or tested. So we're kind of working on strategizing a few things there. So
How many counties are doing the free STI testing?
I think us in Kansas City do it free for anyone. I know Clay County offers it for their citizens.
So I guess my question is there access is there? You just have to physically show up to do it.
Yeah, so
And it's not going to cost you an arm and leg to do it.
shouldn't.
Jackson County funded a grant to University Health to go out and pay people to come in and get tested.
Oh,
To parks and other places they put this on. It was funded. Not only would they pay them to show up and get tested and get educated, but if they had any need for urgent follow-up, further testing, treatment, things like that, they would refer them down to University Health's fast track in their ER, and everything's paid for. I only know that because my wife participated in this on several weekends.
As a provider.
As a provider. Lord. And some of I will tell you, there's 4 research papers that can be published out of their data right now.
wow.
Because the most common STD is, gosh, what was it? I'd have to look it up. It's something that isn't routinely tested.
HPV, but then
Mycoplasma,
Mycoplasma chlamydia?
no,
mycoplasma genitalium.
genitalia,
Genitalium.
which needs to be treated.
Yeah.
But it's not something that we were trained in, and it's
Yeah,
not
that's not-
something that's
That's-
typically tested.
What
What
the
is
medicine?
the treatment for that?
Zithromycin?
A doxy.
Doxy.
Oxy. Oh, okay.
Just
So anyway,
curious.
I share that as informational so that there's things going on in different counties that they're trying to address this with, not just, I mean, it was not just free testing, they paid people, and then they got the outcome data to show.
We're bringing the numbers down.
Whereas they had data of what they thought the incidence was, and then when they paid people to come and get tested, it's different.
Mhm.
Did they do follow-up
Yes.
after, and they had to come back again and
If
see?
they offered the follow-up, but if, for example, somebody tested positive for syphilis,
Uh-huh,
they bring them down and get them their injections, and they would follow them over time.
just curious if they, many times what I
But
find
they
is
had a big grant to do it.
some
I
folks
think-
are not real compliant with taking the medication to cure the problem that they have. So,
Or if they do get treated, the partner gives it right back to them.
yes, so that's the issue.
There was lots of education along those lines. They had follow-up going, but I shared it only that there are counties that are doing very proactive things. And I'm hoping to get their spreadsheets to look at the data, because they aren't gonna publish on it. I already told the 2 ladies in charge, one's my wife. I'll write the papers. It's really neat data.
So we'll talk about this a little bit later, but I think one of the big things we
I
did
can
last
tell you.
month was working for a new medical director. So like doing the interview process, making new training materials for them. So
Is he going to introduce himself? Is he coming to one of the meetings or anything?
I will invite him after he gets on board.
um,
he can certainly do virtually fairly easily, but he wants to come too, so.
I'd love to be. So.
And then following up from last month, I think Dr. Kingsley and Dr. Shea are asking about HPV testing being offered. So I was looking at some of the prices. It kind of varies depending what type of specificity you're getting for the test. So the generic one, just kind of testing like for those high risk HPVs, starts at around $35.46. Then if it's reactive, they do a reflex, and then that's doubles the cost.
And they pay for that, not us. Or is that what we are charged?
This is what we are charged,
Yeah,
for test. So
yeah.
I mean, I'd likely to be more if they were to pay for it.
Right.
And then they also have this one they've actually had within the past year. I just discovered is like actually a self collection test. That was around $40 to be provided that way. Then those are just the cheapest ones that are currently available. Like just goes up from there.
For HPV, it's a self collection test.
They have one that's new and available. Yeah, I haven't. So kind of look through the data compared to see how what like the false positive negative ratio is and how effective it is compared to the other ones. I would doubt it's as effective just because when you're trained to like do an actual collection versus someone who's getting a little pamphlet to kind of collect themselves real quick, it probably isn't going to be as.
I say a guy would be easy. A woman, that might be more difficult.
But yeah, I just thought I wanted to share that and follow up with you guys and how we have on there. We did partner with Health Ed. Like I know they did a few different activities where they kind of do blood pressure training and screening and like helping a lot of caregivers, teaching them how to do that. So I know they had this. They actually had to go and present recently and had a class all day, and had really good positive feedback from a lot of people. Like didn't really know that. Oh, hey, I need to have my feet on cross when I'm sitting there. I need to like kind of sit there, relax for a few minutes. I don't have that. Should I have my arm like right here or up? I just at heart level. So all of them said they really benefited from it. So we're hoping to do more of those in the future. I know they're trying to go out at least quarterly to like different YMCAs and try to get people that way. One of the big things we're doing with WIC is they got their e-cards are now out. The first week that they got them, they gave out over 400 of 600 cards that they have for.
You might want to explain what an e-card is.
I was about to ask.
So the e-card is basically before you gotta get like your, you'd have to come in, get like your WIC check certified and then upload it to your account. With the e-card, it puts everything on like an app and you can automatically they can do like a telehealth visit and then they can upload it on there. The Missouri Department of Health actually has a really good YouTube series they just released that kind of explains it more for clients. It's in English and Spanish, but you can go through like select like whether it's fruits and veggies, dairy, all those different things and show you like how much you have for like what different products will qualify. It's a really good reference for those who are kind of, if you're new to it, can be a little bit overwhelming trying to know what's covered, what's not. And then just a really easy program. You just use your app and then use it to checkout, and then it will automatically deduct right there, so you know exactly how much you're using for it. And as you're shopping, you can just put it in a little calculator and it tells you how much you have left over for other things. So.
And I talked to Jill and Trisha about that.
Mm-hmm.
So they'll be getting with you and Heidi to get some of that stuff linked from our website so people and some of our social media so people know that that's available, but also kind of how that works.
They also had a prenatal baby shower on May 6th, hosted by Healthy Blue. Got a lot of really great feedback. Healthy Blue was able to donate some prizes for us to give out to the clientele. The baby wearing like baby swaddles, those are like the most popular items that people were really grateful for. And
how many people showed up?
Just 23 total.
23.
So.
Oh yeah, 23. I didn't see that far. Okay.
So we did have.
I need to read.
And then the next page is it's probably gonna be on the TV. It's the handout I gave you guys, but it's patient satisfaction surveys. Not as many this month. They only had 6, but they were all very, very highly rated. Mostly 5s, a couple 4s, and then the one caveat was there's one person who started filling out a survey who was very angry apparently and just rated 1, 1, and 2 for the first 3 questions, and then they gave up. So that one I keep with an asterisk on there, but overall the comments are very, very positive. Everyone seems to really love Zara and how she cares for her patients. And a lot of them referring to her and like just loving the space and how welcoming everyone is here.
So now that we know they're 15 to 18 patients per provider per day, what should be the numbers that we expect for a monthly total, just for curiosity?
It's gonna be depending on how many days they're open.
Yeah, so what days are they actually having clinic?
Wednesday and Thursday.
So just two times a week
2
times
days a week,
4,
yeah.
so 8.
Yeah.
Okay,
60, 150.
so we're probably 50% where we should be? Is that give or take?
Yeah, I think it's I think I did the math earlier. It's about like 8.7 repeating is what their average patient count per day was. So yeah, about the halfway point.
They're gonna have to work with us to reach out, for example, to city council in Platte City, Weston, to get information out there. I think getting with the sheriff and informing them that they see people who can't afford healthcare, which the sheriff's department and the police department are aware, to encourage them, to give them the information, say, contact the health department. Or they don't need to tell them SWOPE initially, but SWOPE is collaborating with your health department to get you access to care. There's so many things that can be done to ramp this up. But the biggest one, quite frankly, is the best marketers are the people leaving the clinic telling 5 other people. And not just that, but you have to market to your current patients and tell them about telling other people. And not just depending on what they can accept as far as insurances and contracts, tell it to everybody. If it's not just good for Medicare, Medicaid. Customer service is what gets you more business.
What days of the week is it again?
Wednesdays and Thursdays, and on most Wednesdays we'll have dental here as well.
But they'll see people down at Riverside, or you can go.
And that's Monday through
Clay
Friday.
County.
I'm not
Riverside's
100% sure on those days, but I think that they're most of the week.
Okay.
Yeah, I believe Riverside's every day.
Monday through Friday, not weekends.
No.
Yeah, okay.
So what we're really looking at is, because I look at that map, Riverside's full. They're busy, they're doing fine, they can take excess capacity. But the places that can't, I think, would be what I would recommend. Heading up to Weston, getting the Platte City folks, finding some other smaller towns to
This-
make sure you go to the mayors of all these small towns in person.
In the small towns, the hub of the town is the school.
Yep.
And the school activities.
You go to the school
So
nurse.
that's where you go, is the school.
You got, I'm talking to you guys and you guys know I'm right.
Yeah.
You gotta go into that school nurse first. Say,
Yeah, it's the school.
how bad is it?
And the social worker.
And the social
Absolutely.
worker at the school, counselors,
Yeah.
that.
But that's what has to be done, and I think that we can provide that kind of guidance to the folks at SWOPE. That we will grant our blessing to what they're doing here, and that we can reach out as part of what I think our scope of what we're trying to do is to get out to these other areas, because again, Riverside, the southern part of the county is covered. But we can expand up, and Platte City is 15-minute drive here. Weston's about what, 35, 40, 35? So
20.
20.
Yeah.
But there are other agencies that provide services and care in this area that maybe they're not targeting doing the same things as the health department, but for instance, I'll give an example of Parkville Women's Clinic. They also target and help people and get them set up with services. So that would be a good place to,
great idea.
provide information to them, because
Mhm.
they're, trying to support families too.
Just to clarify about the business hours of Riverside, so office in Riverside, it is Monday through Friday, 8 to 5.
8 to 5.
So I was right, but I didn't sound very confident, but I do want to make sure for the record that that is their hours.
Here's a question. Where do our clients go, SWOP clients go after hours? Or Saturdays and Sundays? Do they just go straight to,
ERs.
which ER do they go to? I mean,
ER and urgent cares.
Mm-hmm.
right? But is there a particular one they're supposed to go to, or how does that actually work? Do they have a protocol they
They have
follow?
a call line.
Like a nurse triage tells them you better go
Right.
to whatever? Yeah. So I'd be curious if you could find out where they refer them to. That'd be nice to know. Okay. We keep like hijacking your guys'
Sorry.
presentation, sorry.
That's all I have. If anyone has any questions.
Taylor?
All right, so for accreditation, we're moving and grooving. The numbers have gone up this month. I think so we're at 34 documentation that have been completed. So I think domain 6 was, I think we had nothing there from last month, so it's moving up. I think that domain 5 has gone up. Domain 6 was environmental health, and 5 is the largely related to the community health improvement plan. So I think so each domain kind of pertains more or less to different divisions. So I think that everybody's kind of really starting to get the hang of the documentation and the types of documents and things that they need to be producing. And so then everybody's been doing a great job of getting those in. So we've set due dates for certain ones over the next few months, just to have at least a rough draft completed by. So I think that that's really been helpful because we've been doing that through the planner app on Teams. So it sends reminders, things like that for, so that people are like, oh, I want to get this done because this email is annoying. So they like, sometimes it's nice to be able to check something off. So I think that that's been really helpful. I think you all know we've been working on our strategic plan, quality improvement, workforce development plans. From Taylor Anderson from the Missouri Public Health Institute is going to be coming to our June meeting to be talking about the strategic plan, going over the mission, vision, values. Thank you all for giving feedback for that, but I think she's going to come and do a presentation with the board and have kind of a discussion around that.
So we do have a draft, right? Or we'll have a draft to present,
Yeah.
hopefully before the meeting, so it goes in the packet.
Yeah. It'll be in the packet.
But I thought we had an excellent meeting where we took the feedback from what you all had said and the staff strategic planning retreat. I really liked at least what I've seen of what the new mission, vision, and values are going to be. Just pretty straightforward and encompassing what, in plain language, what the health department should be doing. So we'll get that to you, but we'll be discussing that and getting your input at our next meeting. But I thought it went real. I was surprised.
Yeah.
I don't know if you were surprised,
No,
but it was way better than.
Yeah, I'm looking forward to being able to post our mission, vision, and values in our building. Just for a reminder for all of us and certainly for the public too.
We'll probably do something around that big logo up front.
Yeah.
Somehow make that like fit into the display. It's gonna look nice. And no, I'm not lighting it up.
And then policies and procedures is another big project that we're undertaking. We're gonna have around close to 200 policies and procedures that are based on previous ones. We're just reformatting them, again, making it a little bit more health literate, plain language, easy to read and understand, so that all the staff can understand things. If someone's not there, they can pick up a policy and ideally know how to do certain things.
And look the same, I think.
Yeah.
We have tons of, it's not at all like we've not had any. We've had them for years. I think we just they've evolved and they haven't all been written in the same kind of format and that type of thing. So I think just having, like, if you're looking at the policy and them all following one kind of scheme, you know where to go to each one to find the meat that you're looking for. And it'll just look nice, and we'll get it on an annual review schedule, and that's going to be very good to review those every year, make sure we're still documenting what we actually are doing.
I think I mentioned that Dan had written a ton of policies, and then now we've had a lot of new environmental health and health education policies. So I think people are also getting the hang of that. So everybody's just moving and grooving.
Okay.
When we do
sounds
these
good.
policies, are those policies that we already have, and we're just
A lot of them.
cleaning them up and make them bigger, brighter, beautiful, whatever?
Some are, and then some are required through the accreditation process.
And we're starting from scratch on those, essentially?
I'd say adapting what we had to make it fit.
Okay.
Dr. Chaffee had mentioned, what are the metrics for a health department? What should they be measuring? accreditation is a lot about, in some ways, not so much how many services or wing flaps. It's more along the lines of how are you providing those services? What policies and techniques are you using to figure out what services you're providing? And it's that type, it's structural are the guide, like a lot of the guidelines. And Taylor, you can cut me off because I know you are more immersed in it, but a lot of it is more like, how do you measure this and what in place do you have to capture this data? Who are your partners? And it's that type of stuff.
And then another big thing is the Northland Health Alliance is working on their strategic planning also. So I've been attending some of those meetings. I think they're kind of like looking for new ways to find more funding and expand partnerships and have some new partners. It seems like they don't want to expand out of the Northland, which I think is a good thing. There was some talk about that. A few people were talking about moving out of the Northland, but I think there's already some other organizations that already have that capacity. But there's a few more meetings related to that, so that's been going really well too.
And then Taylor's been trying to learn other things because Dan wants to leave. So, the fire inspector was here and she tagged along for her first fire inspection. And he didn't let her wear hat, didn't let her wear fireman boots or nothing.
He was a lot nicer to her than he used to me.
He was very nice.
And Dan, you accompanied them, right?
Just have to know who his boss is.
Yeah, there was a couple of minor things with that, but we've already fixed all of those things. It was just one or two of the exit sign lights was out, and we just had to mount one of the fire extinguishers. So we've already had Frank, our maintenance man, has already done those, so they're going to come back at the beginning of June.
If he wants to know his name and cell number, I've got it.
But some of these things, I think it's just great experience for Taylor to, she hasn't done some of these and she kind of looked at me like, what, I have to go. And she did great, but it's great experience.
Yeah, I also did a tour on the roof and learned how to change out the filters in the HVAC system. So,
and he didn't push you off, or you're very resilient.
You pushed me.
Were the filters nasty?
Yeah.
Filters are still looking good, or were they nasty?
I mean, they were dirty, but not like
But
horrible, like this
who
normal.
in a building typically thinks about changing out filters?
Nobody.
You have to have it set in a calendar, has to be part of the
Yeah.
protocol.
Right.
So we use this app called MaintainX, and it does have the ability to set up reminders I think it's every 3 months or so.
It varies because spring, you have more pollen and more pollutants. So we've now been here for 2 years, so we have actually fine-tuned the schedule. The filters are not cheap. And so we want them changed if they're dirty, but we don't want to change clean ones. So like it actually varies throughout the year. Like in the winter, I think we go a little bit longer than we do in summer and spring. But it is pretty interesting. MaintainX, you all may remember, you all approved that. And and I know Dan has been, as he is kind of like, this isn't going to be my problem, but he's like, but Andrew's going to have to do this and this and this, or someone's going to have to, but it's all in there. And I think that's very helpful to, like, Dan's legacy is still there, just all the things that like he knows in his head at this time of year, we have to do this. Well, I don't because I have a Dan. And so now a maintainer says, well, you don't have a Dan, someone's got to do this. So, right?
So yeah, you can schedule reminders on there, which is really helpful.
But you've been putting that stuff in, right? I hope.
Yeah.
That's what I thought you did. Because I see the stuff come up.
And then I guess the other thing is yeah, so Dustin and I and Trisha and Bailey, as Dan mentioned, we did the leadership challenge that Andrew and Dan did a couple months ago. And so we did that, it's not on our report because we did it Tuesday and Wednesday this week. But it was 2 full days. And it was really good, really great to, lots of like different aspects to think about. And then we did a lot with like talking about our own values and looking at like our own vision for, it's kind of weird because they ask us to write our own vision, but it's sort of like, what's your vision in relation to the health department and things like that, and then to write your like I believe statements for workplace development type stuff. And then I know Andrew framed his when he did it. So.
And I told Dustin and Tricia, once you finalize yours, give it to Cindy and she'll get them framed for you.
Okay.
So where are you gonna put them? Just curious.
Mine's in my office.
Is it okay? Okay.
And Dan, did you frame your vision?
Yeah.
Yeah, so they framed different things.
That's cool.
His
It was
says, listen to
great.
Andrew. That was
And then do the opposite.
It's like a calendar, just like his retirement date on there, just stares at it. Like,
Yeah, I think we all really enjoyed it. I think we got a lot out of it. It's hard to be away
And
from
it
two
is
place,
an-
but-
It is an expensive course. I think it's about, I think what they say, like $1,500 the first one. But it is something that the state of Missouri was paying for. So we actually didn't pay for it. And we probably have the biggest representation is my guess,
Yeah,
because I kept pestering Tiffany. I said, hey, if there's spots, tell me, even if it's last minute, we'll get all our people there. So we got roughly,
4 out of 15, so.
yeah, so $6,000 worth of training because we were willing to be flexible and get people in when they needed them. And it's a great training.
It was really good. I think we all enjoyed it.
And there's ongoing meetings and like they do a one-on-one kind of coaching session and talk to you about, you know, well, your chair of your board says everyone needs to be a director within 12 years. So what do you need to do to get there? And so they talk to them about those types of things.
They need me to come give a little blurb or something. More than happy to come and do.
I think the people will pass, but thanks for the offer.
Well, and then at the very end, we did, like our was it a compliment or a final encouragement or whatever? And they wanted it done in a creative way, and it was like each table was supposed to choose one other person in the group, and it was 3 out of the 4 of us got, recognized at the end of that, so.
Wow.
Dustin and I and Trisha all got final recognition.
And at my session,
Apparently
Dan got
did too, yeah.
recognized. And then, so it's Bailey and I are the only Platte County people that did not get
Got some
recognized.
work on.
Because you guys are just like
We gotta
energetic
work-
go-getter type people and
work
everybody
on
else
that.
wasn't, or what was the deal?
No, I mean, just different things,
So basically, like, because they had us broke it up in like 4 different tables, so it was funny how it ended up because like most of Platte County, except for me, was at one table. And I was at another, so they had nominated me. I think I got the sympathy vote. My girlfriend had been in a car wreck the night before, so I think they were just kind of like, "Oh, he needs this victory." But yeah, no, it just happened. It's just really funny that we all ended up being
Very cool.
3 out of the 4 people who got nominated. Like the creativity.
they
Awesome.
wanted it to be a creative thing too, so we gave Dustin a cape and a little crown and a little spectrum.
Little scepter.
Scepter, yeah, I was like,
Yeah. I will give a shout out to Bailey though, even though she didn't get the creative thing, she was very active and like and very engaged in the whole conference and had a lot of really good insights. So I'm very excited to see her in a leadership position and see what she does with that going forward.
Finance committee did not meet.
We did not meet because of Paylocity.
So I'll just, and it's already been kind of said, but our finance team has really been doing a lot of new things coming all at once. And then like the board meeting, they do a lot of the reports and different things we need, which is kind of why the packet went out a little late because they were busy doing other things. And Cindy kind of said, Andrew, you don't say a word. You just leave them to their things. And I listen because I know better. But they have been just working their tails off. There's a lot of new stuff that's coming. It's all going to be better for the health department in the long run, but there's a lot of things to do.
Excellent.
So shout out to them.
Yes, thank you.
Finance reports from me.
Paylocity, that was the finance report, on top of, open enrollment, and we're trying to get stuff rolling on the new banking agreement. So it's stuff like that.
Review and approve the bills.
Okay, do we have a motion for that? You guys had your chance to look at stuff and all that?
Yes, I'll make a motion that we pay the bills.
Wait a second.
A second,
Okay, any further discussion? Susan?
Yes.
yes.
Me, yes. Mike?
Michael, yes.
Yes.
Fee resolution.
And this one.
Okay. Wait till Dan gets down to. So I think I had mentioned, I at least talked to Dr. Kingsley about it, but,
Excuse me, I'm gonna do the personnel action on him first.
That's good.
is that in their packet?
I think so.
What's the issue?
Just his
It is
personnel
under new
actions,
business.
Proving him as a hire. Is it on there?
Great scroll up to.
It's
Oh,
under
maybe I
new
don't- I don't
business.
have it.
I see this, but
Yeah.
It's under new business. I think.
Yeah, it is under new business. There's a sheet in there.
What's the medical director's background?
Yeah, you have it.
He is a neonatologist working in Joplin.
Okay.
So we posted the position. And we had, do you remember how many applicants? It was like, I was
13?
gonna say 12, but it was 13.
13, okay.
We narrowed it down to 5 that we would interview. We ended up only interviewing 3.
Two. The third one dropped afterward.
Yeah, he pulled it back
Okay.
in conversation.
But anyway, he's a neonatologist in Joplin. It's actually someone I knew, and I had suggested that he apply because he had said he was interested in working more in public health. And so I don't know what other kind of background you want.
I'm just curious.
Okay.
I didn't know.
And those donations are made on his behalf so that he can take them off his taxes?
No,
Oh,
he just,
okay.
basically, we had talked to, because we're going through the audit. He just wants nothing to do with the money. He doesn't want any tax implications. He doesn't want anything associated to him with it.
Got it.
He wants just it to be, given to the animal shelter. And basically, because of how we would be doing it and not charging anything as far as like hourly rate, it will save just off the top about $400 to the health department. And then both Jen and our auditor said, this can be done, you just need to do it the right way.
Right.
But I felt like I should bring it to the board, largely because that is a unique compensation approach
Right.
that I have typically, we haven't done. So I thought you all might want to consider that.
You and I talked, what will be his monthly interactions with us? Like, what would be a typical month for him? Like, what would he be doing for us?
I'll let Dustin answer that.
So essentially, whenever I write standing orders, like we'd be reviewing them, getting guidance on that, reviewing our any labs we perform or anything like that, just reviewing the different charts for patients and making sure that if there's any questions we may ask for, just like, the random patient that kind of falls about outside of the little standard guidelines, seeing what their rationale for that is, and kind of getting their advice on there and kind of acting upon that.
Question I would have is to make sure there's enough documentation of why tax dollars are being donated to a shelter. I don't have an issue with it. But if it's called on the carpet as to why the Platte County Health Department is donating money to a veterinary clinic, I think we need to make sure we have that nailed down in advance.
Which is why we're doing this.
Absolutely, and that, this will serve as it, but for future reference, we need to make sure it's clearly articulated somewhere and easy to find. It's one of those things that if somebody was feeling like we're not as a group doing a good job, being good stewards of the tax dollars. We have to show that's ideal. I think this is the right way to do it, to bring it before the board for approval. It's archived and documented. It's,
And you and I had discussed too, that if we would have had somebody else, we may be paying double, maybe even way more than that for a director position.
Right.
So it saves us in the long run so
Andrew
much.
County got somebody for free.
Oh.
You didn't know dog donations and nothing like that?
Oh,
You don't negotiate very well.
they begged for help and they needed the help. It's not
So
that
they
hard.
did beg, and they had asked us what we were paying. And Clay County was having to look in Independence, and the prices,
I don't-
we were like, what is up here was, Dan, do you remember? It was like a third of what, like, it was really cheap compared to what everyone else was wanting. And it was largely just holding the position for those consoles.
Well, and if he's just reviewing documents and things, it's not a whole lot of work.
Right.
Like the most work I've had in the past 2 months was I had to review fit testing questionnaires for the employees at the department to make sure that it's okay for them to go through the fit testing.
And Cindy can go into it a little more, but we can't bill any insurance without having a medical director. So we are using
Yeah.
his credentialing to be able to bill. And if we don't have his credentialing, we can't bill.
Question. So on this personal action record, it says board signature. All of us have to sign or just me?
No, just you.
Just me, okay. I just didn't want to take up the whole spot with my name.
I wonder if I can combine the motion and to approve the new medical director and the compensation package all in one. Everybody okay with that?
Mhm.
I would make a motion to accept Dr. Oberoi as the new medical director and authorize a monthly donation of $1,300 a month to Parkville Animal Shelter in lieu of compensation for Dr. Oberoi for his services by County Health Department Medical Director.
And the donation is in his name. Right?
That was not a request.
It was not, okay, all right.
If
Okay.
you want to add that, you can, but
Just leave it alone.
It's clear he doesn't want any headaches,
Okay,
but he has made the request, so it's. I don't know, that's a good question. I would think it's not a problem, but we're giving the money to them for his request and we've got it in the record. That's how we're doing this. And if he gets changed out, then that money goes away.
right.
okay.
I can. If you amend the motion
Oh, yeah, well,
to just say it can, or maybe you don't need to. I can talk with him
Wait,
and
okay,
Jen.
So what are we talking about? Because Kenny,
Oh.
said it needed to come from us. The check
Okay. So.
The check had to be in our name.
Come from us.
Right.
We're issuing the check.
And then can we put in the memo or something
And
in,
it's
in-
not donation.
yeah, in the name of Dr. O'Brien or something like that. So it's actually documented.
It will be
Right, right.
issued from us.
I think the question is whether we
It's on
Put it-
our own.
in
There's-
his name,
There's a paper trail is what I'm trying to say. Yeah, yeah.
but I suppose I'll just check with him and our attorney and make sure.
We
it's
might want
done
to check with
appropriately.
Jen on this.
There's the importance of that because we need to be in compliance with how we're spending the money, but the board gets to decide that. I think it's just, that's a good idea. So I'll keep my motion contingent upon approval of our
Legal
legal counsel regarding the logistics of the transactions. But
Can you restate the motion? though?
well, I move to authorize monthly donations of $1,300 a month to Parkville Animal Shelter in lieu of compensation for Dr. Oberoi for his services, Platte County Health Department Medical Director, pending the approval of our legal counsel.
Is that fair?
Yep.
Okay, you have a second?
I'll second that.
Any other further discussion? Susan?
Yes.
Okay.
Yes.
Me, yes.
Actually, yes.
Yes.
The only issue with that is we didn't accept the personnel part.
It's implicit in the
Okay,
motion that
all right.
So as long as,
we're approving him for health department medical director and his compensation.
Perfect.
just as long as Jen Snyder signs off on it, we're good. Okay,
So if Jen is not, what would that entail?
She's already told me. She just.
Oh, did she? Okay, okay, okay.
I just want a paper trail, because like what he was saying, what, 3 years from now, somebody comes back and goes, well, what the heck is this nonsense?
Mhm.
We can say, well, it's because of this, this, and this, that's why.
Like why are we buying $15,000 worth of coats once a year?
Right. What is the need for that? Why are you donating money to an animal shelter? What is the need for that?
Exactly.
So the check will have his donation for him on the memo?
That's what we're, yeah.
Okay.
Okay,
Well, at least if it's in the budget, the line item, the code for what it's, as long as that's in there and it can be traced, in case we all get voted out.
It will be there.
That's
It is
important.
going.
Great.
okay. Do we have any public comments from anybody from the audience? Nope, okay. What else you want us to do here?
There's the speaking.
Oh. I forgot to ask, because you usually say, are there any additions to
Oh, are there any additions to the agenda?
So there is something that I put on each of your places. I got an email this morning from Tom Patrizzo with Beacon Mental Health. And they were requesting support letters to submit to Department of in support of the creation of a behavioral crisis center. Kind of goes on, and I'll let you read it. But he said, they believe that ER visits and law enforcement encounter data supports the need for a behavioral health crisis center in the Northland. They attached a support letter. I did email him and ask him if he could share that data with us. He hasn't responded. I mean, I sent it this afternoon. I didn't get anything back.
It's a flashy name, but what is it they're actually trying to
What is
accomplish?
this?
It's in the letter.
I mean, this is what I know.
Right.
So.
Okay.
Basically, if you read the letter, it's basically asking to get funds to create a clinic for behavioral health.
Well, I can only speak for myself, but having reviewed this and gone through, and we are currently going through trying to get reports from Beacon on some other items as far as how many Platte County residents they take care of for the funding that they get through another tax levy we have. There's the Platte Ray and Clay County Mental Health Fund that has 2 board members appointed from each of those 3 counties to administer funding that goes to Beacon Mental Health mostly. So we were trying to track and see what sort of auditing they had on how many clients from Platte County. And we're hoping to get that data in May, at least the commissioners.
This month.
Yeah, this month. So I look at this and I'm personally, I can't get behind this in the time frame that they want because I have lots of questions. I need the data sources. I need to know what their budget and operational guidelines are, how they're going to track the data. It's essentially, I don't know the scope and the practice. What I can tell you from being an emergency physician is when somebody is suicidal before they get admitted to a hospital, they have to get medically cleared. It's nice you have a walk-in clinic. What are the hours? When is it there? How do we get behind something?
Yeah.
And
Sketch.
I
Need
just,
more information.
This, yeah, definitely lots more information needed. I don't really, that doesn't tell me anything
Um,
at all.
I have to see what the real data is and the need for it, just as this health department reviewed the children's services fund data that was available to determine if we as a board needed to take action for children's services and mental health in our county. Before I would vote to sign off on a support letter, I would need to look at all of that. So
I just don't want to be throwing money into a boondoggle without any results, no idea of what a success is, what a
well,
failure is.
this is us supporting them to get money from the state. Is that correct?
That's what I understand so far. Like, I know very little about it except what this email was. But you know, you had said you'd like to see the budget and operational guidelines.
Letters are due
would
back
like
by
to-
Tuesday.
Yeah.
They
the
want
five-
this by Tuesday.
5 days. But wanted to see the
The
data.
answer isn't no, but they need better
Yes.
information before you
Yeah.
close to get into it.
First one,
Yeah.
this is actually sitting at your places because we have had this discussion multiple times. But on a day-to-day basis, the management team and myself, we are the ones you've entrusted to run the health department. Some of these policy type decisions like this, you know, considering the other things that have been going on and knowing that we're trying to get data for some of these initiatives, this seemed like, you know, and I talked to Dan, I said, we should just take it to the board and let them weigh back. And Dan's like, well, they're gonna want to see the data. And I'm like, well, thanks, Dan.
Yeah, we.
So I'll send this email, but
Yeah.
you know, it's just one of those things. The response was what I assumed would be, and I will reply.
So
and
how
just
is,
say we'd like,
and you can let them know how, we aren't, you can tell them from me.
well, I think the board,
Yeah, I mean, I'm not saying we
I
don't
don't wanna,
need this.
I don't wanna drag you all into my
No, I'm not
enthusiastic
saying we don't need
rhetoric.
it. I,
but I mean, I think the budget and operational
Structure.
guidelines, liking to see the data that support the creation.
Right.
Um,
Do you know where they physically want to build the building?
I don't know, Clay County.
Just anywhere, but we don't know where specific.
No, I think they're gonna operate this out of Beacon. They want a walk-in clinic for mental health services. To decrease the load on ERs and law enforcement. I don't know that there's a linkage that I can follow how law enforcement is gonna run across fewer cases, or is it that because law enforcement, when they have mental health issues, they bring them to the ER.
Yeah, there's
It would be too dangerous to drop them off at a
you're not gonna
clinic.
drop them off at a clinic.
Yeah,
You're
that-
gonna take them to a place where they
It's too
can be
dangerous to
medically
do.
managed.
Bad things will happen. You do that.
Yes, that's not how it's.
I mean, I think that falls in the operational guidelines to me of like, how are they perceiving this will work with the needs in the community?
I'll be blunt.
Tim, do you disagree? Like, when we ask that question of them, that's what they've got, that's what I'm expecting
More
to,
information.
from them, is for them to describe how that would
That's,
all work.
that's.
I'm not
perfect.
saying it will work. I'm
That's
saying
perfect.
that we want to know how they think it will work.
Sure.
Clay and Jackson County, over the last 5 years, have a children's services fund. We're talking 5-figure millions of dollars. And we were led to believe there was a huge crisis afoot. I think I'm a little gun shy and feel like we've been hit with data that didn't fit the need previously, and having a last minute letter of support without scope, data. I will not vote to authorize
Seems like
our
a back
director, deputy
doorway
director to
get in there.
authorize anything without further good data and information, given how I got to see this children's services fund play out.
Because if we do give our approval, that'll be plastered everywhere.
Well, quite frankly, there's, I'm not gonna
I think
make
there's
that
just
statement.
questions.
This isn't the right place for it, so.
Yeah, there's just questions.
Okay,
I can't support this.
it's not a no, but we need a lot of information.
So would anyone be opposed when I respond if I copy you all? You'll know not to respond back.
Right.
Right.
But you can
Love it.
then see
Perfect.
what I
That's
said.
fine. Yes.
Is that okay? With you?
Sounds awesome. Yeah.
You're having to dance a line here, I know.
No, I'm just gonna blame Dan.
Yeah, why not?
That's a safe decision. I like that.
I wanted to write the letter, but Dan said no. No, when I read this request, I'm like, there's so many other things going on that, like, we haven't quite finished with the other things that we're trying to
Right.
get feedback on.
Correct.
This seems a little premature to like jump into a whole. It's a different thing, but kind of the same thing as far as rationale and the data. So,
Dan, what's your take on this?
I agree. As Andrew mentioned, when he and I talked about it, my first thought was, well, we need to see data, to support such a proposal. So,
Need to see what the scope of what they're proposing is.
yeah,
Urgent psychiatric care, medication assisted treatment for opioid use disorder, psychiatric assessment, brief therapy. These are all services they currently are offering. Am I wrong? Now, people who need drug treatment need drug treatment. If they walk into a clinic there, they're going to need to get referred to a substance abuse program, an SAP, as they call it.
It says in meeting one of the greatest needs in their community. It's a big deal according to these guys.
Well, we had a crisis in Platte County that got voted in by the citizens that I don't think was based upon as good a data as we could have had.
Okay. So there
Turn
you
that
go.
recorder off, you hear what I really think.
no, we can't do that.
Teasing, teasing.
All right. What else is on the agenda? What else we got to talk about?
Yeah, that's actually it. But thank you for letting me get that in. I just wanted to make sure that we were all on the same page.
Yes.
And I really felt like that was probably the approach I was going to take. But, I can't read your minds. So if I would have said that, and Dan and I kind of agreed that we probably want more data, but we just say it, and then you guys are like, what? You never even asked us.
Yeah.
So.
Okay.
I think we just need to.
The next meeting will be June 18th, 2025, 6:30 p.m.
Which is a Wednesday.
Wednesday, yes, so a special time.
Or later.
Yes, at the Platte County Health Department. Okay, do we have a motion to end the meeting?
I'll move to close the meeting.
We have a second.
I second.
Any further discussion? Susan?
Yes.
Kim?
Yes.
Me, yes. Michael?
Yes.
We are officially done. Thank you, everybody.